Hi, Dr. Kathy. How are you today? We're going to talk about the G spot. Again, one of my many favorite topics, the G spot. All right. So I know we all know that this is very controversial, that a lot of people do not believe in the G spot. And I'm going to say right up front, I am a true believer in the G spot. From my experience, I am telling you it exists, but it's not easy to find in some women. Sometimes they need help, and I can tell you that you will get a lot of help when you know where it is. And that's the question. Do you know where your G spot is? All right. So, first of all, a little bit about the G spot. The G spot is actually named after Dr. Ernst Grafenberg. He discovered it over, almost a century ago now. But in 1940, Dr. Frank Adiago actually named it the G spot. And ever since then, and in the early 20th century, they were really talking about this G spot, and they didn't really have a way to study it except using cadavers. And of course, they palpated it in some women, but couldn't find it. So eventually, they did some MRIs and some biopsies and really went to town looking for it. And up till recently, they started using women and trying to get them aroused to find the G spot. But it was really a difficult task. And most men do not believe the G spot exists. But there are some women, some female researchers that do believe, and like I said, I do believe the G spot exists. I'm going to try and explain it to you because I know it sounds really like hocus pocus, like weird, but it really is still something that is being studied. And I know that still some people don't believe it exists. But I'm saying that based not only on my experience, but based on what I've read and studies, this does exist. It's hard to find for a few reasons, and I'll go over that in a few seconds. So, where is it? All right. So, I drew the vagina right here, my little stick figure of the vagina, and it's located actually about 2 to 3 inches anteriorly. Okay. So, this is the anterior. So, this is if you're lying down. This is the anterior vagina, right? This is the wall, and this is the posterior vagina. Okay. And about 2 to 3 inches in, you're going to find the G spot. Okay. And that G spot is surrounded by so many tissues. But the most important tissue that I love to talk about is the clitoris. Remember the clitoris, right? So we have the clitoris, and it really lies this way because we're looking at a resection, a trans, I think it's a longitudinal cut, or is it a transverse cut? I think this is a vertical cut down. So we're looking at a transverse view of the vagina, and this is the cervix. If I lie it here, it's a little bit small compared to the diagram, but this is sort of where the two sort of can meet, right? So this is the vagina, and this is the cervix. When stimulated, a lot of times, one of the studies, and again, many people, again, don't agree with this, but they do suggest that the vagina, when it does get stimulated with penetrative sex, that you will find that the cervix does move down. And I believe, again, this is my personal opinion, this is not any research I've done, no research I've done, just read, but this is my personal opinion and from women I've spoken to, patients, clients, that this does come down, and only when you're stimulated, usually penetrative sex, vaginal sex, toys, because without getting into the vaginal canal, it's sort of like you're not hitting that spot because I think it develops when you are stimulated. Now, obviously, you can probably get it also with just clitoral stimulation. But when you involve both, especially with a partner, I think you're going to get more of not only the swelling of the clitoris, the crura, the bulbs, but you're going to get the whole area stimulated and erotic so that you'll get some response in terms of some sort of either neuronal response or a physical downplaying of the the clitoris into the vagina anterior wall. I really do think there's that connection, that it gets woken up, and once it comes down here with the urethra in the middle, so the urethra is here, so your bladder is here, right? And then the urethra comes here also. So when you put that urethra there in the picture, you're going to get a complex, right? The cervix, the urethra, and the anterior vaginal wall. And I think where they all meet, that is where you're going to get the G spot. So it's very important for you to look at the area about 2 to 3 inches anteriorly. Okay. Now, when you are looking for it, of course, you've got to be aroused, but they say that you have to do like a motion of come here, your male partner. It's very difficult for you to do it yourself. I don't know whether you can. If you can, go ahead. But there's a come here motion. If you're coming from out into the vagina, there's a come hither, like that. Come here. That's the motion that you're supposed to use to try and find a gentle softening or swelling of that area about the size of some people say like a quarter, some people say a dime. It varies from women to women, but you're going to get some softening and some area of increased excitement and increased sensitivity. And the woman will tell you that if you are able to, if you're the partner, locate it for your partner. And a lot of times women can do it on their own, and sometimes they have a partner do it. But that area becomes softer and different in texture to the rest of the vagina. Okay? They do say that if you have more space between the vagina and the urethra, you have a better chance of having that G spot. And some people don't have a lot of space. So it all depends on, again, each person's anatomy. The anatomy of someone that has more space here probably has more tissue and so more activity and a bigger sort of G spot versus someone that has less space, less activity, and a smaller G spot. Okay. About 63% of women believe they have a G spot, studies show. 63%. 7% say, no, they don't believe they have a G spot. And the 7% says no, says they don't have a G spot, and then I think 30% feel that they don't know if they have a G spot. So again, different studies. There's so many different studies giving you different percentages, but generally that's the most recent study that feel that there are women that feel they don't have it, and I truly feel it's because either the hormone levels are low and they're not able to get a good reaction in terms of tissue and sensory nerve stimulation, and also I think the anatomy itself has to be a certain size, the clitoris, and has to be swollen and activated. So again, that neuronal, hormonal, chemical pathway, physiological pathway, all has to get everything woken up in order to locate that G spot. So the most important thing to remember is that that G spot cannot be located unless you are stimulated. So you can't just do it out of the cold blue sky or just out of the blue. You just can't wake up and let me check it. You've got to really be stimulated. And depending on how much you're stimulated, you'll get a better chance in terms of finding your G spot. So if you're looking for your G spot, you want to do it with a partner, which is my advice. And remember, this G spot is connected to female ejaculation. Like I said, I'll talk about that tomorrow. And that's because they're all close together, and that is also thought to be involved, the G spot in the female ejaculation. Okay, they've done studies where they've checked the posterior wall and the lateral wall of the vagina, and they didn't really get anything, stimulatory or exciting. Even the cervix, which is up here, the cervix is this way, they didn't really get that much excitation from women in their studies. But that general anterior wall, 2 to 3 inches anteriorly up, is where they did find a lot of people saying that there was an area there that definitely was sensitive and hypersensitive and aided and helped them have their orgasm. Okay. The interesting studies that show that women are saying that they do have this G spot is probably because different parts of that same area are involved. So in that small area, we have the anterior vaginal wall, we have the urethra, which is coming from the bladder, we have the urethral sphincter, which surrounds the urethra, which comes again probably into this G-spot. The bulbs occur, like I've shown you before. The clitoris gets involved and gets swollen and gets involved in that area too of the G-spot. Skin glands, which are also part near the urethra, okay? The paraurethral gland, again, more glands that surround the urethra, and they say that's the male prostate. Take note, the male prostate is also, when stimulated, gives an extra orgasm from the general stimulation of the male genitals, where their orgasm is, pretty good. But again, when you get that prostate stimulated, it's an extra boost and extra sensations. Some people say 10 times compared to the regular stimulation of ejaculation in men. Same thing, some people compare to the women. If you can get to this G-spot, it's extra, it's a bigger orgasm, including now the female ejaculation, as they say. And we'll talk about that again in tomorrow. But that is where the whole complex is said to really be hypersensitive because of the male prostate, or the paraurethral glands, which we call equivalent to the male prostate. And then the Cobelt's plexus, which is the whole area there that's surrounding the nerves and the sensory system in that same area. And they call it the clitoro-urethral vaginal complex. Clitoro-urethral vaginal complex, meaning the clitoris is involved, the urethra is involved, and the vagina is involved. So to find that area, you really want to be able to, first of all, understand that it is considered to be a complex. Some researchers say it is a complex of all these different tissues, and some people say that the connection to the brain is unique because of the nerve innervation of that area, but they really can't seem to find that connection, which is why it's still a controversial subject in terms of, does it exist or does it not exist? But I truly believe it exists. You need to be able to understand that, you lay on your back, you put your legs up, try and find it. If you're having a problem finding it, definitely be patient and know that this is something that you probably might have to get your hormones checked. Again, your testosterone, your estrogen, your progesterone, and other things, get a physical and find out whether that's the reason why those tissues are not being sensitized because of low hormones. There could be other issues, sugar issues, pressure issues, lack of circulation, lack of desire from other causes, but right now the G-spot does exist. I truly believe you can find it with help. If you need some more help, always reach out to your provider, someone like me that can actually help guide you along the way also. And there's a lot of literature out there right now, a lot of books and studies on this topic too. So don't give up. Get those hormones checked. Get someone that will be with you, a nice partner that will work with you, that will consent with you, and have that G-spot checked. And we'll talk about the female ejaculation tomorrow, which is going to be, again, connected to the G-spot and your orgasm. Okay? All right. Have a great night, guys. Bye.